birthday. So I was asked to talk for a few minutes about 5 small topics: housing, healthcare, immigration, the state of the women's movement, and the most recent elections. Who put that list together? David? Not me. Anyone going to take? Okay. So I'm going to blow through a number of these topics in about 10 minutes, but let me just make 2 comments about that list of topics. First of all, the 4 substantive policy areas, healthcare, housing, immigration, state of the women's movement, are obviously all completely impacted by the most recent election. And what I'm going to do, probably talk 2 or 3 minutes about what I and our state legislature has been working on in the last few years in these areas, but how I expect the debate and the fights, frankly, to shift now that we have a Trump administration. So that's sort of observation number 1. Observation number 2 is though related to that, which is those 4 topics are topics that typically, and I say this with the greatest respect to any Republicans in the room, are top priorities for the Democratic Party. And really values of the Democratic Party around inclusion and thinking about how we take care of everyone among us, that I think will likely become flashpoints in the coming months and in the coming years with the Trump administration. So let me proceed. Starting first with healthcare. So I serve on the Assembly Health Committee. I also serve on the Budget Subcommittee that makes decisions around billions of dollars of healthcare spending. And in the last 2 years, in my first term in office, we have been busy on a number of topics, from passing California's first right-to-die bill for individuals who are terminally ill, the ability or the opportunity under a lot of rules, if you have a terminal illness, to take your own life. We also had another debate which was far more, I think, controversial than it should have been, about whether children in the state of California ought to be required to be vaccinated against common childhood diseases. That particular debate ended up having probably the longest lines around the Capitol of people who wanted to public comment, literally wrapping the state Capitol building several times over. But we now have insisted in the state of California to protect all kids. We require certain vaccinations of school children in their elementary school years. Glad to know this is a crowd that supports that. Not all crowds do, as you might have seen at some of my office hours last year. 2 other topics that I have been leading on. One is around the collection of healthcare data specifically for LGBT communities. A number of years ago, we had a debate in the state of California about whether we ought to collect similar data for ethnic communities. It was on the ballot. Many of you may have remembered Proposition 54 from about 10 years ago. It was highly controversial, but we ended up as a state saying we need to collect this data because if you are African American, you are 10 times likely to get sickle cell anemia. If you look like me as an Asian American, you're 10 times likely to get hepatitis B. If you're a Latino kid, you have a 1 in 2 chance of getting diabetes by the time you're an adult. And so we know that we can save lives and better target scarce resources with data. Unfortunately, we haven't collected that same data for our LGBTQ communities. And we've known that, for example, if you were transgender, 1/3 of our transgender community doesn't have health insurance. If you are an African American male, you are more likely to be affected by certain diseases than if you're a white gay man, and so on and so on and so on. And so we have had a 5-year debate in the Capitol about whether to collect this data, and I'm proud that this past year Governor Brown signed a bill that I had authored representing really the capital of LGBT California to start the requirement and the collection of this data again so we can keep everybody healthy. Now, a last topic I'm going to mention, which is one that I have spearheaded, which I had hoped was going to be something that we would be talking about post-election, has been around one of the highest drivers of healthcare costs. And for those of you who follow healthcare inflation, you know that the cost of pharmaceutical drugs is not going down. We have had great medical advances in recent years, but we have seen pills that cost literally $1,000 a pill retail if you have hepatitis. We have seen pharma CEOs this past year carted out of their offices in handcuffs, being arrested for fraud when taking HIV and AIDS medication and multiplying the price by 5,000%. We had a very difficult discussion in the last couple of months on the ballot. Some of you may have remembered Proposition 61, which in the history of the state of California, the most expensive ballot measure, paying for millions of television ads that all of you were forced to suffer through. And unfortunately, that measure didn't pass. But that issue will continue because at this time, healthcare inflation is still on the rise, being driven significantly by healthcare costs. Now, November happened. So what happened to a number of these issues? Well, first and foremost, the issue of drug prices will likely fall off the political radar. And in fact, a few days after it was confirmed that Donald Trump would be our next president, you saw the stock prices of pharmaceutical companies jump up 10% in the course of a day. But probably actually more importantly, as many of you know, Donald Trump has committed that he is going to scrap Obamacare, the Affordable Care Act. And regardless of what one may think about that, if that actually happened in the state of California, it would be a $15 billion hit just to state government alone, which is unfathomable at this point. And in addition to that, we would likely see millions of Californians lose their insurance overnight. And so we are going to have a very significant conversation depending on what the Trump administration decides to do in the area of health insurance and how we react as a state to that. So topic number one. Topic number two, housing. As Warren just mentioned, I am the chair of the Housing Committee. When I went to the Assembly now 2 years ago, San Francisco at that time, we were really the epicenter of the housing crisis that we all now know is around the state. So we often start really good trends. That was a trend that was not so good. Having the highest rents, the highest home prices, the highest eviction rates, the highest foreclosure rates in the entire state. But unfortunately, much of the rest of the state has caught up. Let me give a couple of statistics. We have in our state about 10% of our country's population. We have 20% of our country's homeless. 25% of our country's homeless veterans, 1 out of 3 of our country's chronically homeless. We have 500,000 kids who are homeless, and we have 1.5 million families that lack access to affordable housing. These are stunning statistics that apply all the way from the Oregon border down to the California-Mexico border. Now, why are we here? I could talk for 3 hours about this. Let me just mention in 45 seconds what I think are the root causes of why we're here. One, we have failed over the last 10 years to invest in housing in the way that we used to. When the Great Recession hit us in 2007, 2008, we lost $2 billion a year as a state that used to leverage billions of dollars of other private sector capital to build housing. So that's cause number one. Cause number two, we have had many communities that have often fought or not allowed or not prioritized building housing, not just low income or workforce or homeless shelters, but market rate housing. And then third, and this is true in the Bay Area, we have a tremendous disconnect between where jobs are being created and where people are living. So Silicon Valley has seen hundreds of thousands of jobs created in recent years, has only built during that same time period tens of thousands of jobs. What does that do? Those workers get on the 101, get on Caltrain, get on 280, jam up our freeways, congest our streets, and drive up the housing prices in San Jose, Oakland, and of course our city of San Francisco. So what is the agenda? Before last Tuesday, I had told my colleagues, and in fact this was mentioned just yesterday by our speaker on our first day in the legislature, that 2017 we hope is going to be the year where we focus and tackle housing. I have been leading this charge in the legislature on the money side, trying to get more money invested in housing, as well as thinking about how do we streamline housing development and how do we ensure there's a better linkage between where jobs are being created and where housing is being built. But we have an awful lot of work to do in that area. Happy to chat about that more. Now, how does Donald Trump impact all this? It's interesting. On this topic, we really have no idea. And in fact, we have no idea from who he just nominated, announced in the papers this morning. I thought Ben Carson could have been a pretty decent Health and Human Services or Surgeon General secretary. He is now going to be the secretary of HUD, which is Housing and Urban Development. And we really, truly have no idea what Ben Carson thinks about housing, so stay tuned on that conversation. The next topic, now I'm just doing sort of speed rounds, immigration. This, as you know, is going to be a very, very sort of intense flashpoint. California, we are the home. I like to say our city, our state was built on the backs of immigrants, has succeeded because of our immigrants, and has a future that I think is going to be economically successful because of our immigrant communities. And we've been able, as a state, to adopt policies that have been extremely welcoming of immigrants. So, for example, I helped to create a program to encourage legal immigrants and to move them on a path to citizenship. We also have moved forward a number of other policies to ensure that we're putting immigrants to work, ensuring that folks have health care, ensuring that our immigrant families really have a stake in our country. All that being said, I'm sure everyone here knows that during the campaign, Donald Trump talked about deporting 11 million immigrants and building a wall. After being elected, he's now talking about moving out immediately this year about 3 million immigrants. Yesterday in the legislature, we had our first day. It's typically a very joyous occasion. But our Democratic leadership, we asked our colleagues to support a resolution on day one saying that our immigrant families should be allowed to stay in California, which ended up kicking off hours long of debate on this topic. So on that topic, on immigration, stay tuned. I think, as many of you know, the big question is, if the state of California, if the city of San Francisco, if cities like San Francisco decide to take the perspective that we are going to fight the president on immigration policy, will he cut billions of dollars of federal funding to so-called sanctuary cities or states like California? Stay tuned. Last topic is around the state of women's issues. And I have been honored to work very closely with our state legislative women's committee on a number of different fronts. In our first year, Governor Brown signed one of my bills that would provide protections for victims and survivors of domestic violence who are trying to get out of tenancies and to be able to help those women and their families be able to survive and move on. We also were able to lead on an issue involving choice. This past year, I had the kind of big issue in the pro-choice agenda, which involves so-called reproductive crisis pregnancy centers. Some of you may know and see the signs on the bus ads. Are you scared? Are you pregnant? Come here. What you may not know is the vast majority of so-called crisis pregnancy centers are fronts for pro-life organizations. And regardless of where you are on the issue of choice, 70% of these clinics, when you walk in, you will be told that if you ask for an abortion, if you receive an abortion, you will get breast cancer, you will become depressed, and you will likely become suicidal. And so I had a bill to require those centers to provide a piece of paper telling you that you have certain constitutional rights under the U.S. Constitution. All this being said, as you know, these issues are also very much at play. Donald Trump has said he will appoint a Supreme Court justice who would support overturning Roe v. Wade. And there's a real likelihood that if he gets 2 Supreme Court justices, I would not be surprised if that were to happen. So these are difficult and serious issues. And let me just close by saying the following. I'm trying to think of something to be uplifting, because it is the holiday season. We live in California. The weather is beautiful at this moment, and again, I know that some of my dear friends here and elsewhere are Republicans. We actually do have a 2/3 majority in the legislature of Democrats, which means that the conversation that we're going to have in Sacramento is, you know, now that we are likely the Democratic state capital of the United States, how do we peacefully coexist? And as I've said with the Trump administration, we want to agree with them where we can, but we will be fighting the Trump administration around those values that I think all of us share as San Franciscans and as Californians. So stay tuned. And with that, Merry Christmas, Happy Hanukkah, Merry Kwanzaa, and now to your questions. Thank you so much.